Hello everyone. Welcome to SexMed Connect #talk episode 5 Sensate Focus Therapy. This is initiated by Dr. Neeraj Jadhav sir, Apurva Datta sir and Shama Sultana. And coordinators of this session is Dr. Shama Sultana and Dr. Naisar Patel. This is me, Dr. Shama Sultana and Dr. Naisar Patel. She is a consultant gynecologist at Gayatri Maternity Nursing Home, Pata. Welcome, Dr. Naisar. So, today's topic
Thank
is
you.
sensate focus therapy. So, what is sensate focus therapy? It is a structured therapeutic technique that is developed in this form. It is intimacy, sexual awareness, and also sexual functioning by helping individuals or couples focus on the experience of touching and being touched rather than on sexual performance or orgasm. And through a series of gradual and non pressured exercises, partners learn to pay attention to physical sensations, communicate their preferences, and reduce anxiety and strengthen emotional and physical connection. By shifting the focus from achieving a special sexual outcome to enjoying present moment sensory experiences. Sensate focus therapy is effective in addressing issues such as low sexual desire and performance anxiety, erectile dysfunction, and premature ejaculation, sexual pain disorders, and relationship related intimacy concerns. So, after knowing this, what is exactly is sensate focus therapy, we will focus on exact questions what all we need to understand about it. So, let's start the hash talk. So, Dr. Naisargi, please once again, just in your words, let us know what is sensate focus therapy.
Structured and behavior therapeutic technique that help couple to improve their intimacy, sensual awareness, communication by focusing on the experience by touching and being touched rather than on sexual performance or orgasm. It's like a pleasure instead of performance, and it's promote relaxation, mindfulness, and emotional connection between the couple. And it will reduce anxiety and pressure associated with sexual activity. It's like it's develop, improve the intimacy, sexual functioning, reduce performance anxiety. They focus on touch and sensory awareness, and it's improve the communication between and increase the emotional and physical connection. So Dr. Sharma, I have a question like what is the main objective of sensate focus therapy? Can you tell us?
So, the primary objective of sensate focus therapy is to help individuals focus on present moment rather than only sexual physical sensations rather than worrying about the performance and expectations, arousal, sexual arousal, or really ending up in the orgasm. This shift in attention reduces anxiety as well and enhances sensual and also emotional experiences of both the couple and focus on sensations rather than outcomes really and reduce performance pressure and promote mindfulness, improve body awareness about each other and enhance intimacy and pleasure as well. So, Dr. Nesargi, why should partners avoid judgmental thinking during the exercises?
Yes, because judgmental thinking interferes with the ability to fully experience sensation because it places individual in the role of observe rather than the active participation. And by avoiding evaluation and criticism of the partner can remain present and engaged in the sensory experience, like to prevent distraction from the sensation. It's encourage the active participations, reduce anxiety and self-consciousness, promote emotional engagement, and enhance sensory awareness. So, Dr. Sama, I have a question. Like, what is the sensate? What is the step one of the sensate focus? Can you elaborate that?
Yes, step one, it involves non genital touching where one partner acts as the toucher and the other partner acts as a receiver of the touching. The focus is entirely on sensory exploration without involving the breasts, genitals, intercourse, or oral sex, allowing couples to reconnect with touch in a non-pressured environment. So in this, there is a non-genital touching only, and one toucher and one receiver will be there. No breast or genital contact will be there, and of course, no intercourse or oral sex will be there. And they will focus on the sensory experiences of both the couple. So, Dr. Nesagi, what is the difference between sensuality and sexuality in step one?
It's like, sensuality and sexuality, it's called like two sides of the one coin. In that, like in step one, sensuality refer to experiencing like touch, sensation, texture, smell, warmth, and bodily sensation without the goal of sexual arousal or sexuality. And sexuality means like focus on the erotic stimuli, thoughts, arousal, and sexual activity. The therapy emphasizes sexuality to help couple reconnect without performance and expectation with pleasure. Sensuality focus on the sensation, sexuality focus on the arousal. Sensuality it's non goal directed and sexuality it's the aim at sexual outcome. So Dr. Sharma, I have a question. What should the receiving partner focus on during touching in sensate focus therapy?
Okay. So, in this, the receiving partner should focus on their own physical sensations and emotional responses while being touched by the toucher. So, rather than evaluating or directing the touch, they are encouraged to remain aware of how the experience feels in the present moment when the toucher is touching. To focus on the personal sensations of their own body and avoid analyzing and judging that they are not touching there or here or there. So stay present in the moment and observe emotional responses and communicate discomfort if necessary, if they are not comfortable with that touch. So, Dr. Nesargi, how long should step one touching generally continue?
So step one minute to allow both partner to move beyond the initial awkwardness and they should feel comfortable and know each other's body and fully engaged in the sensory experience. However, session should be prolonged to the point of the boredom or fatigue. Minimum 15 minutes it should be there helps outcome initially awkwardness, increase sensory awareness, avoid boredoms, and avoid physical fatigue. So it should be minimum 15 minutes. So I have a question, Dr. Sharma. What is the texture awareness exercise in sensate focus therapy?
Yes, it is interesting, means at very unknown to many. And if it is practiced, it will be very interesting. That is the texture awareness exercise. It involves exploring and comparing the textures of different body parts and also such as cheeks, neck, hands, and legs. And this exercise enhances sensory awareness and helps individuals focus on their tactile experiences and where it will feel more sensual or sexual. They can encounter. So it compares skin textures, which part is having that texture, and also enhances tactile awareness about their body, and also and encourages mindful touching, improves sensory perception, and supports sensual exploration as well about their sexual nature. So, what should partners do if they become sexually aroused during step one? So, please let us know, Dr. Nesar.
Yes. So if they are having sexual arousal during this step upon it, they should focus on sensuality instead of having sexual activity. They should continue focusing on sensual exploration rather than allowing session to become the sexual encounter. Like arousal is normal in the sensate focus therapy, but they don't pursue sexual and continue exploring sensation. So I have a question, Dr. Sharma. What is the step two of sensate focus therapy?
So here, as we have discussed about the step one, where toucher and receiver is there, here the step two expands the exploration to include next level, that is breast and genital touching, while still avoiding kissing and intercourse here. The next step. So the emphasis remains on sensory awareness rather than sexual again, performance or orgasm. So it includes only breasts and genitals. There is no kissing or intercourse or continue sensory exploration as well in those sensory parts, and maintains non-goal directed focus in this as well. So Dr. Nesargi, what is the purpose of hand riding technique?
Partner to provide speed and location of the touch. It enhances communication while perceiving or improve communication between the partner, encourage partner awareness, and maintain sexual explorations. So, Dr. Sharma, how should genital touching will be incorporated in step 2 in sensate focus therapy?
So in step 2, genital touching will be there. It should be integrated naturally into the broader exploration of the body rather than becoming the central focus. The goal remains sensory awareness rather than sexual stimulation in this part also. So part of whole body exploration, avoid excess focus on genitals and maintain sensual perspective and encourage variety in touch, and also prevent performance pressure in this as well. By touching the genitals, they should be very tender, or they can touch in other ways like hand or other parts of the body of the toucher. So in likewise, the genital touching should be in a many ways exploration of the different sensations in it. So what is the step 3 of sensate focus therapy, Dr. Nesar?
Includes mutual touching. So, like both partners allowing to touch in awareness of both partners and giving and receiving touch while strengthening intimacy and communication. So, this is mutual touching, simultaneously giving and receiving, and it improves the intimacy also, and it's encourage is the shared experience. So, Dr. Sharma, why it's kissing discouraged during step 3? What is the thing? Why it's discouraging?
Yeah, actually, kissing is discouraged because it may trigger some, automatic sexual behaviors and old patterns of interaction. If kissing once starts, they may jump into the next level of intercourse or much bounded means sexual interaction. So, kissing is avoided in this stage. So, the goal is to develop new sexual means experiences rather than sexual, and remain focused on touch and sensory awareness. So hence kissing is avoided. So as I have said, avoids automatic sexual responses, encourages mindful exploration, and also it breaks habitual patterns, and also enhances sensory focus by directing to the breast and other parts, and supports genitals and supports the therapeutic goals rather than going into the intercourse or further sexual intimacy. So, is orgasm allowed during step 3, Dr. Nesargi?
Well, and it maybe occurs naturally during step 3. So, it's considerable. Orgasm is a considerable in the step 3, and it's like orgasm is acceptable. Not the it's not a primary goal, but focus remaining on the sensation. So, we should avoid performance pressure and encourage natural process. So, what is the step for sensate focus therapy, Dr. Sharma?
So, in step 4, introduces the sensual intercourse, where couples extend their awareness of touch and sensation into the genital contact and intercourse while maintaining a focus on physical sensations. Now, as a step 2, step 1, 2, 3 have learned, make them learn the physical sensations. They will explore along with these physical sensations the actual sensual feeling into the genital tract. So rather than performance or orgasm, they will focus on the physical responses, sensations in the genital tract. So this step 4 will be having a sensual intercourse rather than very physical. So introduces intercourse in it and also focus on sensations, reduces performance anxiety, encourages mindful intimacy, and also it will maintain sexual awareness as they have step by step learned how to sense their feelings and also touching experiences. So, Dr. Nesargi, how should intercourse begin in step 4?
So intercourse should beginning gradually after a period of non-genital and genital touching. Partner are encouraged to focus on the warmth, contact, and subtle sensation rather than the speedy performance. And it's beginning with the gentle touching, then progress gradually, focus on physical sensation, slowly genital sensation, and then vaginal contamination. And use mindfulness penetration and avoid rushing. So, Dr. Sharma, I have a question. Why is communication important during the sensate focus therapy? What is the thing behind this?
So, in communication, it allows partners to express preferences. Like the partner will more understand about the importance of their own body. They can tell to their partner that this is stimulating much for me and this is not. So that communication is very important. That feedback is very important and understand each other's needs, which is very much essential during sensate focus therapy. Without which the partner cannot easily make other aware of their needs without communication. Just knowing about just the facial expressions or so, one cannot tell, but the communication will make them understand how much they need and how much they not, and which is not needed they can stop, and which is much needed they can focus on it. So express preferences is very important and provide feedback and also improve understanding between the couple and strengthen intimacy. It will strengthen intimacy, of course, if one's needs are known, and enhance relationship satisfaction as well, which is very important. The only reason why we are doing sensate focus therapy is satisfaction, to improve the satisfaction. So, what conditions can sensate focus therapy help with, Dr. Nesaki?
Actually, sensate focus therapy, it's a behavior therapy and it's very effective in almost all sexual dysfunctions, including like a low desire, anorgasmia, erectile dysfunctions, premature ejaculations, genitopelvic pain, penetrative disorders, delayed ejaculation, problems and intimacy problem also equally important, and it's important for the trauma and relationship stress problem also. It's like a low sexual desire, ED, premature ejaculation, delayed ejaculation, GPPD, anorgasmia, and intimacy and relationship difficulty. Senses focus therapy is very useful and first line therapy in those people. So, Dr. Sharma, what is the recommended therapy schedule in this therapy?
Okay, this schedule should be a typical sensate focus therapy program consists 6 to 8 sessions, including 3 to 4 sessions focused on sensate focus exercises and additional sessions addressing specific sexual concerns. So sessions are usually conducted weekly and last about 1 hour. So total 6 to 8 sessions, 3 to 4 sensate focus sessions, weekly schedule, and 1 hour per session, and home practice between sessions is very important. So this concludes our sensate focus therapy hash talk, and we thank you. So like and subscribe our channel, and for much more videos please follow us, and you can also give queries. Please Nesagi ma'am, please tell the email ID.
If you have any questions or query, please connect on sexmedconnect@gmail.com. And this is our episode 5. If you have any query, please connect us. And please join us our different channels like Instagram, YouTube, WhatsApp group. Thank you so much.
Thank you so much.